Hi, welcome back to the skeletal system. In this section we're going to look at what happens to your skeleton due to exercise and also through life. So specifically we're going to look at immediate effects on the skeleton, we're going to look at long-term effects on the skeleton, and we're going to look at changes throughout the course of somebody's lifespan. So before I do it, just have a little think yourself. So say you went out for a run, try and think of anything that might change in your skeletal system in the immediate term. There's not a lot, to be honest, in that sense. And then think later over life what might have an effect if you exercise or don't exercise. When you've ready, unpause it, and I'll go through the answers. So on the immediate side, the main effect is that you get of your fluid increased in the joints. I don't know if you remember, but they are. That helps you to lubricate the joint. It takes a few minutes just for that to get up to speed. It increases blood flow and nutrients into the bones and joints so they can build later on, and then muscles pull on the bones and joints, so generally you get an increased range of movement. You can get a decreased range of movement if you overtrain certain muscles that are imbalanced. On the longer term there are more effects. So by putting a stress on the bone you increase the bone density and the bone strength. So particularly important to build this up in the early part of your life so you've got a nice strong skeleton as it may deplete later. Increases the joint stability as your ligaments and tendons get stronger. Your posture tends to improve. That means your bones tend to sit in the right place and they're less likely to wear away. We get better cartilage health as a result. We get better range of movement, better flexibility, reduced range of risk of osteoporosis, which can be an issue to some people. And as we've built the bone up nice and strong, and we get a reduced risk of fracture. So let's have a look at your bone changes through your life. This is obviously a fetus, so here in the fetal position you can see the spine is in one curve, and early on in the fetal stage the bone is made just of cartilage. What happens then is you get some blood flow into those cartilage areas and a process called ossification begins. Ossification means turning into bone. Whenever you see os is word for bone, so ossification means it's turning the cartilage into bone. Newborn baby has about 300 bones and then some fuse together to become adult skeleton. So bone growth continues into adolescence. You will have all seen this as you get taller and bigger and stronger and your skeleton gets heavier. The epiphyseal plates, which we talked about earlier, they allow the length of the bones to increase. And generally we consider the adult skeleton to be complete somewhere between 18 and 30. So generally most people are at their complete height by 18, sometimes a little bit lower in females, and then it consolidates its weight up until 30. Adult skeleton has 206 bones. There are some slight variations of individuals, but generally that's the case. And the strength and thickness of the bone need to be maintained in order for your skeleton to function. So we'll have a look at some of the ways that can happen. What can happen later on is some of the calcium is progressively lost. As you can see by the pictures, the strength, particularly of the cancellous bone in this case, is then reduced as the amount of bone wears away. So breakdown of bone happens earlier in women, generally postmenopausal, as it's estrogen which ensures that this is happening. The risk of osteoporosis increases along with fractures. Osteoporosis is not exclusively female, but it is 12 times more common. One of the things that's good here is weight-bearing exercise. Weight-bearing exercise allows the bone to be stressed. As long as we don't get an injury to the bone will then lay more calcium. Also having calcium and vitamin D in your diet and having sunlight can also help. So I hope you can now review the immediate effects of exercise, the long-term effects of exercise, and how the skeleton changes over time.